Pain, never fun, but when the pain is in your head and neck, it can affect so much. I want you to welcome back to the program Dr. Dwayne Keller, and he brought along Shawn Everson from Keller Professional Group. I say they specialize in helping patients that are dealing with TMJ. And Dr. Keller, first let's talk a little bit about TMJ, just for folks who maybe aren't familiar with it.
Sure.
What is it exactly?
Temporomandibular joint is your jaw joint. It's the joint around which, when you open and close, you get most of your movement, but it also involves the back of the neck, which most people don't know or don't incorporate.
Is that because muscles are connected to the back of the neck that operate the jaw?
Yes, as I'm talking to you right now, you only see my lower jaw moving.
Right.
But I can stop my jaw moving, you'll see the things you normally don't see. I can still talk to you by rotating my head on my neck. So if you have a problem here, you have a problem back here, which gets to your neck, shoulders, upper back.
And if you have a problem back here, then the problems can extend even lower, correct? Which is why it's good for a team approach. What is your approach to fixing the TMJ, your portion of it?
After we do a thorough diagnosis, which is usually about 2 to 3 hours, examining the patient, then what I'll do is I'll start dealing with the dysfunction as far as the jaw goes, and I'll try and find a better functional position. And then what I do is I have the physical therapist begin to work on the neck, shoulders, upper back, etc.
That's where Shawn comes into the picture.
Shawn
so you structurally get it in the best possible position, which is never perfect because there was a problem to begin with.
Correct.
So you get it in the best possible position that you can, and then Shawn, you take over as far as motion, and is it like a training or?
Well, it's really both. Fundamentally, it comes down to, we talk about posture and mechanics. Posture just means positions. We've all heard of good posture, bad postures, good positions, bad positions. And everyone's got some posture issues, but the issue is trying to push it toward normal, toward a given person's best alignment and normal motion. And there's basic criteria that fit normal motion, and part of it is proper positioning, proper range of motion, and then a key part with those then is proper muscle control. And that gets into what's going on. For example, specifically with the jaw, it's so common people who have TMJ problems have ample problems with their upper neck muscles and joints. So it's an issue of getting them moving better and then training the muscles to work more properly.
Because when they were not moving properly, some muscles may have gone unused for so long, and they're overwhelmed by other muscles that were overused.
Yes.
And we kind of have to retrain those just like we would with our arms or legs or any other part of our body, right?
The principles that we work with in rehabbing the jaw joint problem it overlaps immensely as if we were dealing with a serious knee issue. There's fundamental issues of, and again, a serious knee, we want to take care of what's wrong there, but we got to look higher, we got to look lower. The knee is affected by all these things that
everything
it's connected to.
Works in unison.
It's all connected.
And harmony.
And so
we're going for harmony.
Right. And then when Shawn improves the function, then I can change the form to better support that new function.
Okay, so it really is a team approach then.
Absolutely.
All right. Thank you both very much for coming in. If you're experiencing these problems, and you know that we talk about the problems, you may not even know you have TMJ or that there's a misalignment, but if you have this kind of pain, call Dr. Keller at 314-638-4190. He can help you find out why you have the pain and what can be done about it. Or you can always check out the website, DwayneKeller.com, to learn more about TMJ.